The word doctor is derived from the Latin docere, which means to teach. The clinical setting provides a wealth of opportunities to prepare the next generation of doctors for their role as future healthcare providers, on whom high-value patient care undoubtedly depends. In particular, it offers an environment which invites participation, problem-solving, integration of basic and clinical knowledge, and active practice. Across clinical settings, there are a wealth of teachable moments, and the chance to model competent and knowledgeable patient care, together with qualities that are so critical in medicine: effective teamwork, curiosity, acceptance of uncertainty, engagement, integrity, and humility, to name a few. In the context of a rapidly changing healthcare environment, with expanding clinical responsibilities and shrinking time and support for educational endeavors, effective teaching in the clinical setting can feel ever more challenging. But we would argue that it is the very cornerstone of medical education. Therefore, as Osler so wisely stated, "Those who study medicine without books sails an uncharted sea, but those who study medicine without patients do not go to sea at all." The individual. Each individual in a learning interaction or encounter plays a distinct role. The role of the teacher. The clinical teacher plays many roles simultaneously. In the clinical setting, they are often managing patient care at the same time as overseeing learning opportunities for trainees. Effective educational and clinical supervision must have patient safety and quality of patient care as its primary purpose, but must also educate the trainee, promote high standards, identify trainee problems, support the trainee, and monitor their progress. Role of the learner. Learning is an inborn ability that cannot be suppressed. No learner wakes up wanting to appear ignorant, incompetent, or disruptive in the clinical setting. However, as humans, we are constantly attempting to influence others' perceptions of us by regulating and controlling information in social interactions. This can lead to deeply embedded actions happening without conscious thought to lower the risk of rejection or scorn, and can manifest as a reluctance to ask questions, admit mistakes or weaknesses, or make suggestions. Unfortunately, this can seriously hinder the ability and opportunities for effective learning. Today's volatile, uncertain, complex, and ambiguous world requires continuous and often self-directed learning. There is, thankfully, no end to our medical education, and we all remain, in some capacity, a learner forever.